Welcome back to Upfront. Wisconsin residents age 65 and older will be eligible to start receiving COVID-19 vaccines tomorrow. But it's an open question, really, whether there will be enough vaccine available for everyone who wants it, at least right away. State officials say Wisconsin is still only receiving about 70,000 doses a week, not enough to meet demand. We're talking now with Julie Willems Van Dyke, Deputy Secretary of the Department of Health Services. So starting tomorrow with the 65 and up, that's a group of 700,000 people. How long do you think this will take to get everyone vaccinated?
Well, we're hoping a shorter time versus a longer time, but it is completely dependent on vaccine supply. As you said, 700,000 people in this group at 70,000 a week. You know, that math equals 10 weeks. We're hopeful vaccine supply will increase, but we've currently heard it will be steady for the next 3 to 4 weeks. And then beyond that, we'll see what happens.
And have you had any indication from the new Biden administration about that speeding up after those 3 to 4 weeks?
We have not yet. We know the Biden administration is very committed to the rollout of this vaccine. They have already provided additional support through FEMA for vaccine teams to be able to administer vaccine. But frankly, right now in Wisconsin, the issue is not access to providers who can give the vaccine. We have over 1,300 vaccinators. The issue really for us right now is the actual vaccine.
And how much do you need? You say you're getting that 70,000. What does that number need to be to speed this up?
Well, if our goal is that we could vaccinate everyone who wants a vaccine in Wisconsin by the end of June, we're hoping that's 80% of eligible adults, because that's what we need to achieve good immunity across our state. In order to do that, we need more like 1.4 million doses a month, and currently we're receiving closer to 460,000 doses a month. That figure includes both first and second doses.
So there's just no way then that we're still on track for that end of June date, right, for everyone else to get it?
Not at current allocations, but the hopeful news, Adrian, is that we may see additional vaccines be approved. And that is really the key to accelerating this. We know the Johnson & Johnson vaccine is in clinical trials, and we hear maybe close to applying for emergency use authorization. Similarly, the AstraZeneca vaccine in the next month or so. So if we get the addition of another couple of vaccines, that will dramatically increase supply and help us get there sooner.
So I know you know this all too well, that 92% of people who have died of coronavirus in Wisconsin are over the age of 60. So it's not dramatic to say that this is a matter of life and death. And I know you said if you were 65 right now, you would say, at least I know I'll get the vaccine before summer comes. But isn't that precious time lost? I mean, that's months away for people.
It is, and I, more than anyone, want to be able to get those vaccines in the arms of our older adults in our state in the next few weeks. And so that's why we continue to advocate with the federal department, but we can only give as much vaccine as is coming off the shelf. I think the important thing for both people over 65 and all of us to remember is we've done an incredible job over the last year of using other tools in our toolbox for how to prevent the spread of the disease. And I know people are sick of staying home. I know they're sick of social distancing. I know they're sick of masks, but these are the things that people need to do as we await further vaccine supply.
And we have people calling the newsroom really daily who are saying that, you know, they're reaching out to the hospital systems and the doctor's offices, and they're saying, don't call us, we'll reach out to you. And health departments, the local health departments are also saying they can't really handle this huge rush of people. So is there any consideration to a statewide registry?
Yes, we are working on a system where people can come to the state website, similar to how we do with testing, find out where community-oriented clinics, community-based clinics are, and register for those on that site.
I mean, we've been talking about a vaccine and the hope of a vaccine since probably April 2020. So why wasn't this infrastructure already in place and ready to go for when you did get the doses?
So the infrastructure has been in planning for several months. One of the reasons is because we didn't have the vaccine. We didn't know what vaccine was going to be coming. We didn't know what the parameters around that vaccine was going to be. And so we needed to wait until we had that, because all of the programming you do on these kind of scheduling systems is related to that.
And I do have a question about the supply, because I just checked this morning right before I talked to you. And according to the latest numbers that the CDC has, their vaccine tracker, they're showing Wisconsin in the bottom 5 states when it comes to doses administered per 100,000 people. So we're not doing well compared to other states. Are you saying that, we're the only ones having problem getting these doses? What's going on?
So first of all, I'd say about the CDC tracker, we've been talking with CDC because they're usually about 80,000 doses behind what we have actually given. So I'd encourage people to go to the DHS website for the latest and most up-to-date information. And I'm happy to report that in the latter part of last week, we had 2 record days of vaccination. We had 22,000 new doses reported on Thursday and nearly 25,000 reported on Friday. And so there's a number of reasons our system has been ramping up, and it is functioning now, and we are getting vaccines out, and Wisconsinites will be covered with every vaccine that's available.
Okay, Julie Willems-Van Dyke, thank you so much for your time today. Good luck.
Thank you.
Those mobile vaccination clinics we told you about last week have rolled out. There are 9 of them, and they're staffed by members of the Wisconsin National Guard and UW students. Pharmacy students in their 2nd and 3rd years of school have traded the classroom for the clinic.
I'm really trying to work on the mindset of, I'm a student pharmacist, I'm ready to help, here I am, how can I help, rather than, oh, sorry, I'm just a student, let me find someone who can help you.
A Republican lawmaker has introduced a bill to require DHS to present a vaccination plan to the legislature next month, then start vaccinating everyone in the state by March 15th. And a group of Republican lawmakers say that Wisconsin prison inmates shouldn't get priority for COVID vaccinations ahead of other people. Our editorial partner, WisPolitics.com, has coverage of these stories and more online and on Twitter. What does the Republican Party stand for without Donald Trump as president? Our Matt Smith reports on the soul searching some say is necessary. That's coming up next on Upfront.